Okay, good morning. Good morning, Fayetteville. We are here with Your Health in 15 Minutes. We're located on the campus of Fayetteville State University, Bronco Television. I am Angela Stewart. I am a nursing instructor at the School of Nursing here at Fayetteville State University. And today I have the pleasure of speaking with Ms. Alba Natale, who is a supervisor at the Cumberland County Health Department, the Epidemiology clinics and the STI/STD clinics. And today we are going to talk about the state of STIs and STDs in North Carolina. So first I would like for Ms. Natale Alba to just briefly tell me a little bit about yourself.
Well, like you said, I am the supervisor for the STI clinic and the epidemiology clinics at the health department. I am a Bronco, go Broncos. I did graduate in 2014. Before that, I was a combat medic in the military. So when I joined public health a few years ago, about 5 years ago, one of the things that really drew me to my position was the need for public health in our community. And so when I got the position as supervisor in our clinic, in the STI clinic, I really saw that there is much work to be done in our community as far as STIs, as education, prevention, outreach efforts. And so I'm so excited that you have invited me here today so we can speak a little bit about the state of STIs in our community.
Oh yes, thank you so much for being here because this is a very important conversation that people don't like to talk about a lot because of the stigmas associated with having an STD or STI. People just kind of put it aside. They don't want to talk about it. It's embarrassing, of course, but obviously it's quite prominent, especially in our area.
Yes, ma'am, you're absolutely correct. Unfortunately, this is one of the statistics that we really need to know, but it's sad. And Fayetteville as a whole is 5th in the nation for STIs, and that is compared to cities like Atlanta, New York City, LA. So that's something that should be really alarming. Fayetteville only has over 300,000 residents, and so that makes it really, put into perspective what we need to do to decrease STIs as a whole. In this community, Cumberland County, we are ranked 4th for HIV and AIDS in North Carolina.
Wow.
Which is, it's really sad and it's really alarming. And we are ranked, I think, below Guilford County, Wake County, and Mecklenburg County. And those counties are pretty big. They have a lot of a big population. They have a lot of schools in those areas. And so those are some of the things that we really need to focus on. The populations that we have. So we're talking about marginalized or underserved populations. We're talking about young people. Right. We really need to get the education out there because what we want to do is we don't want to be we want to be proactive. We don't want to be reactive.
Right.
So education and prevention is key.
It is key. And just to reiterate, those statistics are alarming. So in the United States, we're right at 5th in the nation.
Yes, ma'am.
With rates. That is absolutely alarming. Of course, we want Fayetteville and Cumberland County to be on the map, but not under those circumstances, of course. So we really have some work ahead of us to do as far as getting the word out.
Another alarming trend that we've seen over the last year, and we do have to take into consideration that COVID has been a big barrier to care all across the board. But a trend that we've seen over the last year is a 30% increase in syphilis rates. Syphilis is something that should pretty much be eradicated because we know it, right? But no, it's spreading like wildfire, and it's spreading in populations that normally would not, be usually susceptible to that. So now we're seeing it in pregnant women, we're seeing it in females, we're seeing it in straight or heterosexual males, where before it was more the men who sleep with men population. But now we're seeing it all across the board in alarming rates. And so we want to make sure that, especially for pregnant females, that we are getting that prenatal care, that we're getting tested 3 times during our pregnancy, that we're receiving treatment as necessary, that we're talking to our partners and we're letting them know, hey, let's get checked before we start our sexual activity or we get to that point. One of the things that we do worry about is that you're correct that we don't talk about STIs. So in our clinic, that's what we do. We talk about it. We are about it. But out in the community, I'm not sure. One of the things that we are worried about is this a conversation that regular providers are having? Is this a conversation that parents are having? That church members are having? That outside agencies are having? And those are really important conversations, because whether we want to admit it or not, people are having sex. People are having multiple partners, and they're a little more risky with their sexual behaviors. While we want to encourage healthy sexual behaviors, we want to make sure that you're safe. Condom prevention, condoms. If you use them consistently and you use them correctly, they prevent so many STIs and pregnancy. If you educate yourself about how many STIs there are out there, I think right now, and these numbers are preliminary for 2022, we had over 3,000 chlamydia cases and over 1,500 gonorrhea cases. Now, what can that lead to? Some people think, okay, well, I'll just get treated and then I'm good to go. Constant treatment with antibiotics can lead to resistance, as we know. So those antibiotics might not work in the future. Now, what can happen if you have gonorrhea and it's untreatable? We want to make sure that we maintain our fertility, that we stay safe. Our anatomy is the way it should be. So we want to really make sure that we are talking about STIs, that we're testing for STIs and we're treating for STIs.
Right. We have to normalize the conversations and, try to minimize that stigma associated with it. So when we're talking about, the syphilis rates in pregnant women, that can certainly affect the babies that are born with congenital abnormalities associated with, having syphilis at birth. So you don't necessarily have to have sex to contract an STD or STI, unfortunately. And, some of the most innocent amongst all of us, newborns, are born with these diseases as well.
Last year, I think, while our numbers remain low for congenital syphilis, last year there was 4 cases of congenital syphilis, which is 4 too many.
It is.
And one of the things that we've noticed, and of course we can't speak on outside agencies and organizations, but in our health department, we've noticed that a lot of pregnant females are not receiving prenatal care. They'll come in during their last trimester, and they're already about to give birth. That is super important to get tested throughout the whole pregnancy, because while you are engaging in sexual activity, yes, you won't be able to get pregnant again, but you can. It only takes one time to get an STI, and so we want to make sure that we are getting tested, that we're getting treated. A woman who has syphilis, who goes untreated, that she can go into preterm labor. She can have a stillborn birth. There can be complications after the birth, and we want to make sure that we don't bring a child into this world already on negative ends of that.
Right. Right, and we just had the maternal health week where we focused on healthcare amongst women having children, making sure that women are receiving the care that they need to have healthy pregnancies and childbirth. So very important to start the testing, start the discussions, start treatment early on and throughout pregnancies.
Yes, ma'am.
Yeah.
One of the things that we want to make sure that all women of reproductive age is please get tested, regardless of whether you are sexually active at the moment. It's super important. There are STIs like chlamydia who are silent, and you can have it and not have any signs or symptoms, and then you think you're doing the right thing, and then here we go, we have an STI, and now we're spreading it to our partners, and so we want to decrease that constant transmission of STIs.
Yes, indeed, that's right. I remember, in school, learning about chlamydia, and it is the silent one, meaning, it's not always symptomatic. So you think that you're fine, you think that you're healthy, you think that you are the only one that is in a relationship with a particular person, and you may be having a relationship with one person, but is that other person in a monogamous relationship with you? So those discussions are very important to have. Obviously, they're not being had at the rate that they should be because of the rates of STIs and STDs in our community. So Let's talk about who you see with positive for STIs and STDs, like the ages.
Okay, the highest, the age group that we could see the most STIs is, of course, is going to be the 15-year-old to about 24-year-old. So we're talking about middle age or middle school children,
Yeah.
and young adults in colleges and universities. So that is the group that we see the most STIs in. Unfortunately, it may be due to several factors, such as I'm not really afraid of STIs because I'll just get treated, or we're not having those conversations, or maybe we never received the right education from the school system, or from our parents, or from, wherever kids are receiving education nowadays. So maybe we're in low socioeconomic populations, maybe we're marginalized or underserved. So that's the group that we see the most STIs in. But let's be clear that STIs are all across the lifespan, and so we do see STIs in older populations as well. Another group that we really want to make sure that we take care of and that we're educating is the men who sleep with men population. They have high rates of syphilis, HIV, and the rest of the STIs. Females, of course, because females, for some, for anatomy and for other reasons, they do carry a lot of those silent STIs, and they can go on without any signs or symptoms. So we do see a lot of females as well. And unfortunately, I want to say that the numbers are coming down, but all across the board, all across the United States, the STIs are they're creeping back up again.
Yeah.
And again, like I said, with COVID, we do have to take that into consideration. During COVID, it seemed like the STI numbers went down. People weren't getting tested, and so they weren't seeking care. And now, because we're out in the community and we are engaging in our regular activities, the numbers are coming right back up again.
They're coming back up. And in communities like Cumberland County and Fayetteville, we're probably seeing the numbers because we have colleges and universities here in our area. We have a very large military presence, and a lot of the military service members are, younger, 20s, 30s. So I'm sure that contributes to the high rate of infections that we're seeing in our area.
We also have to remember that Fayetteville is perfectly midpoint from New York City and Florida, right? And so we are a transient city. We see people from all over the country a lot of times seeking treatment, because you can get treatment in any health department for free, which is fantastic.
Yes.
But we do see a lot of people who are not residents of Cumberland County seeking testing and treatment. And our doors are open for everyone, so whether you're from Cumberland County or not, we'll see you.
That's good to know. And what about the young folk, the teenagers, the 15, 16, 17-year-old? Are they able to come into the clinic and be treated without, what's the process for them?
We do have a teen wellness clinic that we have specifically for teens. Here in North Carolina, one of the statutes is that if you're 13 and over, you do not need parental supervision to come seek STI treatment.
Okay.
So they can make their appointments, they can get tested and treated without their parents' knowledge, to say. Of course, we encourage, talk to your parents.
Sure.
You should. But the Teen Wellness Clinic does provide those services. On the STI adult side, we do see teens as well. We prefer them to go to the Teen Wellness because of the environment, but we're able to see 13 and up. As long as, they're there and they need help, we'll see them.
That is absolutely game-changing because, again, with the stigma, the 13, 14, 15-year-old, they're probably afraid to tell their parent or their guardian. They're afraid to tell their partner. So it's important that they know that they can go to the health department, Cumberland County Health Department, and be treated without any parental consent. So I think that's very important to get that word out, that they're safe to do that. It's a safe space.
And one of the upsides for working at the health department and for having these services is our services are free of charge. The testing is free, the treatment is free, the education is free, follow-ups are free. So while we're probably one of the few places in all of Cumberland County that offer free testing, you know, we have limited appointments, obviously, because we can't we can't see everyone, but we try our best to we update our schedules daily. We try to add providers daily so we can see as many people as we can, because we know that, you know, whenever you pay for antibiotics or for whenever you go to just see a doctor for 30 minutes, that's quite expensive.
It is.
And for a 15-year-old who doesn't have income, who doesn't have a ride, who doesn't have someone to lean on, that can be the deciding factor. And we want them to come to us, and we want to provide that service and that education and that comfort in knowing that this is what we do all day, every day, and that we got you.
They're perfect, 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 perfect. About how many people would you say you see in your clinics on a daily basis?
So that can range anywhere from 30 to 40 people. We have 3 concurrent clinics that are running simultaneously. We have our CDCS, which they provide education, counseling, and they provide the treatment modalities. Then we have our Express clinic. That clinic is really awesome. That is for people who do not have signs and symptoms, but they want to get tested. Maybe they're in a new relationship. Maybe they just left their relationship. And so we see about 7 people a day in that clinic, and that's in the morning. And then we have our general schedule. We can see anywhere from, we have either a 2-provider schedule to a 3-provider schedule. So on a good week, we can see upwards of 150 patients, and that's with limited staffing.
Right.
Our goal is to hopefully have 4 providers on general schedule so we can up those numbers, but really our goal, regardless of whether we see 10 or 100, is to provide those services. So what we need is, when people make appointments, is to show up.
Yes.
You got to do your part.
Do your part, because definitely you all at the health department are doing your part.
Yes, ma'am.
You're doing some very important work, impactful work. You're, you know, helping to save the community and diminish and minimize the STD rates, one person at a time.
That's right.
Just to reiterate, you know, the service is free, the treatment, the testing, everything is free. We just need to work together, our community, to work together to get these numbers down, because number 5 in the nation is not where we want to be. And thanks to you, you're helping to minimize that and do some positive work.
Yep, that's what we're here for.
Yeah.
Call us anytime. And I think I've said this before, I answer my phone all the time. If somebody calls me, I always call back. If people have questions about, you know, if it's a nursing question on how do I actually decrease my chance, we're there for you. Our staff is more than comfortable talking about all kinds of STI-related issues and concerns.
Right. I thank you so very much for having this conversation. Again, we're here, Your Health in 15 Minutes, and this has been a worthwhile, very informative 15 minutes. Keep up the good work at the health department, and again, thank you for coming and just having this very important conversation with us.
Thank you for having me. Thank you so much.
Thank you. So that wraps up for today. Thank you for joining us. Again, I'm Angela Stewart, and this is Ms. Alba Natale from the Cumberland County Health Department. And thank you for joining us for Your Health in 15 Minutes, and we'll see you next time.